living in the new reality of COVID-19 pandemic by Dr. Abba Iguja, who is a medical practitioner in Medical City, KSU, King Saud University Medical City in Riyadh.
All right. Assalamu alaikum wa rahmatullahi wa barakatuh. I hope I can be heard.
Yes.
Great. So thank you very much. I would like to thank the organizers for giving me the opportunity to present this topic on this August event of celebrating the 60th anniversary of Nigerian independence. As you know, COVID is a reality. Just forget about, I'm not going to talk about the sciences, but also forget about all the other arguments people make about whether or not it is real. But all the same, let me just give you a little bit of my objectives, which is I'm just focusing on the public, not to the hospital settings, not to scientists, but I want to talk about the reality of COVID so as to conscientize the public on the reality of the COVID itself, the dynamics involved in its transmission, and how to prevent its spread, as well as how to cope up with living in this reality. Okay, so just a little bit of history. Coronavirus has been in existence as early as the 1920s among mammals and birds, but the first human coronavirus was discovered in the 1960s, which is about the same year Nigeria became independent. So we are coincidentally kind of celebrating the anniversary, the 60th anniversary of human coronavirus as well. Although the initial coronavirus came in the form of mild flus, but the serious one came up in 2002, 2003 in China, and it extended to 2004 in Hong Kong. It was serious with high mortalities and morbidities. And then around 8 years later, we had another form of coronavirus, which is called the Middle East Respiratory Syndrome coronavirus, which originated in this kingdom. Now, that was around 8 years before, and now we have the latest one, which is the COVID-19, which originated in China. What is very important is that since its eruption in China, it has already been declared by the World Health Organization as pandemic in the sense that it's of a global dimension. And that means as of now, we have over 33 million people who have been infected globally, with about 1 million people who have died. And in Nigeria, as of today, we have around nearly 60,000 infected with about 1,000 fatalities. So the thing is, there's nobody who is spared, no nation has been spared, no race has been spared, no geographical entity has been spared, no religion, no gender, no social status. As you can remember, around 3 or 4 presidents have been infected, the latest being the President of the United States. So it is a reality. Forget about the conspiracy theories and whatever. It is a reality, and that is what we have to live with. And for us to know how to live in this reality, we have to understand the dynamics involved. So how is it transmitted? COVID is usually transmitted through respiratory droplets. By respiratory droplets, it means that when somebody talks, when somebody shouts, coughs, or sings, or whatever, some droplets come out from the mouth. And these droplets comes in varying sizes and shapes. So the larger ones drop within a meter due to gravity, but the lighter ones keep floating and flow. They move around wide and far. So if you are kind of close to the person who is already infected, you are likely to have these larger droplets, landing on your face. And if you are, even if you are far away, certain factors may, can encourage the traveling and, the transit of these tiny droplets, which are around 3 microns, further than 3 meters. They can even move up to 6 meters or even more, like if there is some kind of aerosol generating procedures, like in the hospitals, or if it is in a room that is, in an enclosed space where there's no adequate ventilation to reduce the load of this virus in the air. Or sometimes, even if there is ventilation, for instance, there is a fan or some, let's say, AC that is blowing the air, that can extend the distance between the infected person and probably can push the contaminated air to other rooms and thereby exposing others who are not necessarily close to the person. And also the fact that, there's a difference between the risks if somebody is already infected, having the symptoms, than somebody who doesn't have the symptom. In either way, it is very important to know that, it is a droplet infection, but it can become an airborne infection depending on the size of the droplets and also the level, the kind of ventilation that is in the room. So having known how it is transmitted, we can now know how we can also, get infected. So if you have somebody who is infected with COVID, and many people will say that you do the test for them and they will say, no, I don't, you come up with positive results, and they will say, no, I have no symptom, I have no nothing, how can I have, positive result? They will go to another hospital and still come back with the same result. And you will trace their families and they will still have this infection, even though none of them have the symptom. So it's a kind of mystery. So what is involved is, if you are as close as 1 meter or less than 2 meters to a person, and when that person coughs or sneezes and so on, you will have the infection because those droplets will just directly drop on your face. And on your face, you are likely to inhale it. It is likely to land on your mucous membrane, that is on the eyes or in the nose or in the mouth. So you can just get infected directly. Some of the larger droplets will fall by gravity on surfaces. The surfaces could be, the tables or any other horizontal surfaces or on the floor. Now, if you did not come close to the patient, but you came back, or you came even when the patient is, or the person is not around, but you came and touched those contaminated surfaces, because the virus can last on those surfaces for a varying length of time, sometimes as long as 7 days. So it is possible that you may not have a direct contact with the person, but you may have touched something that is contaminated. So if you touch any of those surfaces that are already contaminated, you are likely to get infected if you, in turn, use your hand to touch your face, your nose, or your eyes. So that is the issues involved with the surfaces. Even if you did not touch the surface and you are not close to the patient, as I said earlier, if there are some wrongful ventilation settings, or the patient is coughing, or there is some aerosol generating procedures that is done in a hospital, or the room has a positive pressure ventilation in a hospital, even though you are not close to this patient or this person, you are likely to get these viruses transmitted to you through the airborne route, because the lighter ones usually kind of float in the air and they travel with the currency of the air. So now we know how it is transmitted, how we are likely to get it. So what do we do to avoid being infected with it? The first thing is to make sure that you distance yourself. When we say social distance, we're not talking about really social distance, we're talking about physical distance. So that means you have to socialize with physical distance. And why we do that is because we want to make sure that we are far away to at least to the maximum space during which most of these aerosols will have either dropped on the ground or moved elsewhere. So you have to stay away from this person at least 6 feet so that when he coughs or sneezes, whatever, it will not reach to you. That is the first step. So social distance, socialize physically. Physical distance, keep away at least 2 meters or 6 feet away from the infected person. The second one is the use of mask. You can see this graph was made from the day we had the 100th case globally. And they looked at the trend for countries that started universal masking as compared to those that did not start early enough. You can see those that started masks like Korea, Japan, Singapore, Hong Kong, they had the lowest rates as compared to other European and American countries. So you can see the impact of masks even in the rates. So what do? We have to put on the mask because it has a two-way protection. Supposing you have the virus and you put it on, you are likely to contain it. Even when you cough or sneeze, you are going to contain certain numbers. That means you're reducing the risk to others. If you don't have the virus and you put it on, it will still filter the air that you inhale from others. So in both ways, it kind of gives protection, two ways. Two ways in the sense that it will protect, when you are an infected person, you are protecting others by putting on the mask. And if you don't have the virus, but you put it on, you are going to protect yourself either way. Now, this table shows that if you have a kind of a homemade mask, it will reduce, if you put it on, it will reduce about 67% of the particles that will come in from the infected person. Surgical mask will reduce 75%. And, the N95, the so-called N95 will reduce about 99%. And so on. So this is really very, very realistic. And it is very, very important that you put it on whether you're infected or you are still not infected. So this table just reinforces the same fact that if the two of you, both the person who is carrying the virus and you healthy, are not wearing the mask, it increases the risk of infection by 90%. And if one of them is wearing, the other is not, 70%. And if both of you are wearing, it reduces to less than 2%. So it is very important that we put on the mask whether or not we are infected. And we need to.
5 more minutes.
Thank you. Now, we need to avoid, crowded indoor crowds because of the same reason that it will increase the load of the viruses in it, and therefore you should avoid it. Now, we've talked about the contamination of the surfaces. So if your hands are already contaminated with it, you have to do hand hygiene and you have to use soap and water, or you can use the alcohol gel. After that, definitely you have to avoid handshakes, touching contaminated surfaces anymore. You can use the elbow greetings, which have been officially commissioned in Nigeria somehow. So you should avoid handshake. Now, what else you need to do? You have to make sure that you could decontaminate your surfaces because the surfaces are a good source of these viruses, and therefore you have to make it clean and use any approved disinfectant, disinfect. What about this? You see a lot of people wearing this. Probably you'll have seen it as a status kind of, but I don't believe that it works in an environment, open environment. Maybe it works in a controlled lab environment, but definitely we have experience, we have tested a lot of them, and we don't see it being effective in an ordinary open environment. All the same, how do we cope up with it? We have to deal with concentrate on what you can do. Forget about what others will do or will not do, the attitude. Do what you can do. What is your positive attitude? How do you, how do I follow the recommendations, my social distancing and all that? So you have to focus on what you can do to make sure that you protect yourself. The reality is that this is a pandemic. It has affected everyone, and therefore, no stigmatization. Make sure that you filter your source of information, because there are lots of information moving around that are not necessarily the truth, and they can really make you run mad. You have to protect yourself first, and then support others, and find opportunities to, to share positive attitudes and hopeful stories among your people, and support your healthcare workers. And also, if you have somebody who has passed away, you have to make sure that you handle those bodies according to any approved protocols. If you're on isolation, make sure that this is just to protect yourself, to protect your community, to protect your family. And therefore, please abide by the rules and regulations, stay connected, and maintain your social networks. But if you develop any symptom, please report to the nearest healthcare facility. Maintain social distancing, and make sure that you put on the mask whenever you're going out. And again, hand hygiene for everybody. For adults who are, having some comorbidities, make sure that the families give them emotional support, and make sure that they maintain access to their medications at all times. So what about dealing with anxieties? Make sure that you channel your emotions to something positive, start something new, meditation, drawing, painting, whatever, and also maintain your day-to-day activities and routines. Go back to the basics, eat healthy meals, physical exercise, do something positive, and stay connected with your family. Social distancing doesn't mean that you're social disconnection. You have to call, you can do, you can keep communication with your friends and family, contribute, contribute to the society, donate to a cause, and so on. So make sure that you do something positive, because being negative will not help you in any way. So when will it end? Nobody seems to know, because many people, there are so many prediction models that will say it will end here and there, and some of them will say it will end on, this is a Singaporean university that says probably it will end by December, while others are being so pessimistic that there's possibility it will flare up from January and so on. The most important thing is that no prediction is yet accurate. No one knows when exactly this pandemic will end, so prevention is better than cure. Oh, even we don't know about the cure yet. There's no vaccine. So join the new reality, be proactive. Please stay safe and stronger together. Happy Independence Day. Thank you so much.